In the late 1950s, a new wonder drug swept across Europe and much of the world. It was a sedative, a pill to help with anxiety, sleeplessness, and tension. And it was marketed with a single, reassuring promise above all others: it was completely safe. So safe, the manufacturer claimed, that you could not overdose on it. So safe that it was considered perfect for the most vulnerable people of all, including pregnant women, to whom it was given to ease the nausea and morning sickness of early pregnancy. Millions took it, trusting that promise. But the drug was not safe. In fact, it was doing something quietly monstrous. In pregnant women, it was crossing into the developing baby and interfering with the most fundamental processes of growth, causing thousands upon thousands of children across dozens of countries to be born with devastating malformations. Many did not survive. Those who did would carry the consequences for the rest of their lives. It is one of the greatest medical disasters in human history. And the only reason it did not fully devastate the United States as it did the rest of the world comes down to one woman sitting at a desk at the FDA who looked at the evidence and simply refused to say yes. This is Dark Diagnosis Files, and this is the story of thalidomide. Everything in this account is drawn from documented history and reputable records. This is a case that reshaped the safety of medicine worldwide, and it contains at its heart both a profound horror and a genuine act of quiet heroism. Thalidomide was developed by a pharmaceutical company in West Germany and first went on sale in the late 1950s. It was sold as a sedative and sleeping aid, and it quickly became enormously popular, distributed in dozens of countries around the world under many different brand names. Its central selling point was safety. In an era when many sedatives were dangerous in overdose, thalidomide was promoted as remarkably difficult to overdose on, and therefore it was implied gentle and harmless. That reputation for safety is what led to its most catastrophic use. Because it seemed so benign, doctors began recommending it to pregnant women to help with morning sickness, the nausea and vomiting of early pregnancy. A safe, effective pill to make those difficult early weeks more bearable. What could be more reasonable? The problem was that the drug's safety in pregnancy had never been properly established, and there was a specific, terrible gap in the science of the time. It was not yet widely understood or tested whether drugs taken by a mother could cross the placenta and affect the developing fetus. Thalidomide could, and did. The timing of when a woman took the drug turned out to be devastatingly important. In the first trimester of pregnancy, those crucial early weeks when the baby's limbs and organs are forming, thalidomide interfered with that development. And so, beginning around the late 1950s and into the early 1960s, doctors across Europe, Australia, Canada, and elsewhere began to see a sudden, frightening rise in babies born with severe malformations. Many affected pregnancies ended in miscarriage or stillbirth. Of the babies born alive, a significant portion did not survive infancy. A quiet hospital nursery, rows of bassinets, the muffled sounds of a maternity ward in the small hours. At first, no one understood what was happening. Doctors were seeing these rare malformations suddenly appearing in cluster after cluster. It was a mystery, and a terrifying one. The breakthrough came from doctors working independently who began to suspect the common thread. In particular, a physician in Germany and a doctor in Australia separately investigated and arrived at the same horrifying conclusion. The one thing so many of these mothers had in common was that they had taken thalidomide during their pregnancies. To stand up and say, "I believe this beloved wonder drug is deforming babies," was to invite disbelief, professional risk, and fierce pushback. But the evidence was overwhelming once assembled. And now we come to the United States, and to the reason this disaster has, alongside its horror, a genuine hero. The manufacturer's American partner company applied to sell thalidomide in the United States, expecting a routine, quick approval. After all, the drug was already being sold and used widely across much of the world. The application landed on the desk of a relatively new medical reviewer at the Food and Drug Administration named Dr. Frances Oldham Kelsey. And Frances Kelsey did something that, in hindsight, saved an untold number of American children. She said no, not once, but again and again. Kelsey reviewed the application and found the safety evidence submitted to be insufficient. The data supporting the drug's safety was, in her professional judgment, inadequate and incomplete. Rather than rubber stamp a drug that was popular everywhere else, she asked hard questions and requested better evidence. And critically, she had a specific scientific worry. Kelsey was aware of emerging reports of a side effect in some patients who took thalidomide long-term, a painful nerve condition called peripheral neuritis. This made her wonder, if the drug could affect the nervous system of an adult in this way, what might it do to a developing fetus? It was exactly the right question. Here is what makes her stand so remarkable and so difficult. She was under enormous pressure. The pharmaceutical company wanted this lucrative approval badly, pressuring her, pushing back, complaining about the delay, characterizing her as unreasonable and obstructive. She was a newer reviewer standing against a determined corporation. The easy thing, the expected thing, would have been to give in, to approve it like everyone else had. She didn't. She held the line, insisting on evidence over pressure, on scientific rigor over commercial urgency. Month after month, she declined to approve it while she waited for adequate answers. And then, while she was still holding firm, the news that thalidomide was causing catastrophic birth defects broke. Kelsey's stubborn insistence on more evidence had run out the clock precisely long enough for the truth to emerge. The contrast is staggering. In countries where the drug was freely approved and sold, thousands of babies were born harmed. In the United States, largely because one reviewer refused to sign a piece of paper, the catastrophe was dramatically limited. Frances Kelsey became rightly a national figure. She is remembered as one of the great heroes in the history of medical regulation. But we must not let the American near miss overshadow the global horror. Around the world, the thalidomide children, and the adults they became, lived with the consequences of a drug that should never have been given to their mothers. The disaster left a permanent scar across an entire generation in many nations. It stands as one of the most painful reminders in all of medicine that a drug's popularity and a manufacturer's confident promises are not the same thing as proof of safety. The reforms that followed changed medicine permanently. The thalidomide disaster and Frances Kelsey's stand directly fueled the passage of major new drug regulations in the United States in 1962. These reforms required, for the first time, that drug manufacturers prove not just that a drug was safe, but that it was actually effective. Much of the modern, rigorous drug approval process was shaped by the lessons of thalidomide. There is one final strange chapter worth noting honestly. Thalidomide itself was never entirely abandoned by science. Today, it is used, under extraordinarily strict controls, to help certain patients with leprosy and a form of cancer. It is a peculiar epilogue. The molecule that caused one of history's worst medical catastrophes found a limited redemption, hedged about with exactly the kind of caution its original makers so catastrophically lacked. The story of thalidomide holds two truths at once. It is the story of a preventable horror, and the story of one careful, stubborn person who stood alone against enormous pressure and simply refused to yield. Every expectant mother today who is told to be cautious about what she takes lives in the world that thalidomide's victims and Frances Kelsey's courage forced into being. If documented cases like this one matter to you, please take a moment to subscribe to Dark Diagnosis Files. Dark Diagnosis Files investigates the horror that happens around hospitals and medicine. New cases every Sunday, Tuesday and Friday. Real, documented, told with the gravity they deserve. The whole world was told the pill was perfectly safe, and it took one woman, refusing to sign, to prove that safe is something you have to prove, not something you promise.